Oh my God, exam. G6PD deficiency. Again coming as a university question, and a good number of MCQs are probable. This is basically a defect in the reduced activity of glucose 6-phosphate. See what happens is the glucose 6-phosphate, and there is an enzymatic substance called as glutathione reductase. And this will be converting it to 6-phosphogluconate. When this is not there, there is a decreased transformation to 6-phosphogluconate. As a result of which, there will be the precipitation of the glucose 6-phosphate. There are other things such as the Haynes bodies that can be seen, and pitting. Whenever the substance is getting precipitated, the spleen tries to pinch off the substance, as a result of which there is a pitting that can be due to membrane loss. There can be spherocytes also in a case of G6PD deficiency. There are more than 400 variants. We need not bother about it. Two of these variants we people shall remember. G6PD A- and G6PD Mediterranean. So in this, the younger RBCs with normal enzyme value are seen, but they are inactivated in the older cells. And in G6PD Mediterranean, there is a markedly reduced enzyme activity. This enzyme will be reduced, as a result of which there will be profound hemolysis. It is usually an X-linked disorder, as a result of which only the males are affected. But sometimes, due to the Lyon's hypothesis, the X is inactivated in the female. Therefore, females also can be rarely affected. The clinical features will be jaundice, hemolytic anemia. It can turn out to be chronic. And favism is something that is precipitated by means of the fava beans that has been consumed in Jamaica and other Mediterranean countries. The peripheral smear, you find that there can be normocytic, normochromic, fragmented RBCs because of the pinching off of the substances. Spherocytes can be present. The pinched off cells are called the bite cells. Inclusions can be Haynes bodies, half ghost cells. So look at this one. This is a Haynes body that is found within the RBC as an inclusion. It is diagnosed by means of a supravital staining with methyl violet. Supravital means in a live cell. Unconjugated hyperbilirubinemia is present. Other tests can be fluorescent spot test and methemoglobin reduction test. Also, an assay of the G6PD can be done. These are all the methods of diagnosis. So this is a summary part of it, which is extremely important. I would like you people to kindly draw this flow diagram. We are finished with class number 16. Thank you for your patient listening. Au revoir, one and all.